technology is just naturally very disruptive, and it will continue to be disruptive. So my name's David Ellis. I'm an Associate Professor in Information Systems at the University of Bath. My research mainly concerns digital traces. So digital traces are the little bits of information really that we all leave behind every day. So that's whether we pick up our phone, or when we go to the doctor, or when we get on a bus. And a lot of my research is really just about how you can take those bits of data and do good things with it. At the same time, my research is also really interested in the impacts of new technology. So while we're creating all this new data and we're using it on a day-to-day basis, what are the impacts of this technology? Is it helpful? Is it healthy? Where is it harmful? So those are the sort of two strands of my own research. So a growing area of my research focuses on the notion of missingness, specifically missingness within healthcare. And that's previously been quite challenging to study, because if people are missing, then how do you find out about them? And a lot of our work has looked at patients moving through the National Health Service, and both where they're missing, but also what the impacts are when patients basically are not appearing for appointments. And as you'd expect, the impacts are not positive. Particularly patients who have been diagnosed with multiple mental health conditions, for example. If they miss multiple GP appointments, they're much more likely to come to harm when you follow them up. But this work's also about trying to understand how you can improve the situation. So how can you make sure people are attending appointments or not falling off of various information systems, so that you can then remedy the situation and again, taking digital data to improve the economic and the social situation. In terms of how you can improve the situation, you can build on existing interventions that aim to remind people to attend, but those are often reliant on modern technology that people might not have access to. So for example, that may be text reminders, but it can also involve sending letters. But really, other interventions are more likely to involve better understanding why people are not turning up. So if people are feeling anxious about an appointment, then it might be a case of using other resources to follow up with those people to make sure that they're feeling comfortable about attending. Really, our work sort of suggests that there are things that can be done at a sort of systems level, whereby general practices, for example, could use software that's potentially built from what we've learnt that could help flag patients that might be in need of additional support. But of course, that all has resource implications. So missingness in terms of COVID's a sort of an interesting one, because while a lot of services have moved onto, say, telephone appointments that were less common before, that can be a benefit, because it's easier for people to access their GP. On the other hand, you've also seen a reduction in people going to see their GP for other more routine reasons, and that may have bigger impacts in the long run. So it's kind of about, missingness has become more of an issue really, because you've got in some ways a push or a benefit in that people can access services in different ways, but also you've got this perhaps lack of engagement that needs to be considered in the long run. Yeah. I mean, there's great potential for what the NHS can do with some of this data, in the sense that you can, well, people have even said, this will be the thing that saves the NHS, because historically you would run various trials, you would recruit patients, you would try drug A with one group, try drug B with another group, you would follow them up. But there's so much data within the NHS system that you can actually look at those things at a very specific level, given all that data that's available. So you could rapidly increase the pace of research, and that's before you even think about how you can link that, as we've done, to things like educational data or follow-up death data, for example. So you can see what's happening to people in ways that just would be very difficult if you're doing like a sort of single trial of something, because you've got so many different combinations of people within that system. So one of the big challenges is that people, as we generate more data as individuals, that can also affect groups as well as just ourselves. And one of the big research challenges at the moment is ensuring that people understand what's going on with their data, and if they're happy for things to be done with their data. We generate exponential amounts of data as individuals from different systems that are all now very, very connected to each other. But the research in the social sciences is now playing catch up in that not only do most people not really know what's happening with their data, there's a sort of assumed buy-in that if they did know, would they still want their data to be shared? And that's an ongoing area of research. So the challenges are that a lot of the technological systems we have, whether it's in the financial sector or the health sector, they've been there for a long time, and there's often a concern that if you upgrade or change those systems, you can cause new problems, particularly for your customers or your patients. And there's plenty of historical examples of where a new IT system's been put in and it's caused a lot of problems. So as a result, you have a lot of legacy systems that don't necessarily talk to each other in a way that's particularly useful. Now, our work was some of the first to be commissioned in Scotland to link accident and emergency or hospital data with general practice data, with educational data, and with sort of long-term outcomes like death records. And that was really, really challenging. So we're quite far away from those systems being linked in a way that just happens off the bat. One of the things that's interesting for the academic side of things is that within the social sciences, we've always been used to very kind of static data sets, in that we interview someone or we ask them some questions or we collect some data and then we go away. And really, that's kind of not the way data works in many other areas now, and we're sort of playing catch up in the social sciences, whereby data is now much, data sets are huge, it's dynamic, it's constantly changing, and at the same time there's also rightly, I think, a pressure to make sure that we're as transparent as we can be with our own research practices and our findings. So there's a whole load of challenges there for just people researching or working in this area that go beyond just, well, what questions can I ask, but also how can I do this in a way that's ethical and given that so many things are changing within that area. I think one of the big research challenges is where does the social sciences fit into a lot of this? So, we've previously collected very small data sets from the social sciences in comparison to what other subjects have done, and we're now at the point where, as people's lives are both in the digital realm and the offline realm, how is that changing people? How is that changing the world? It obviously is, but it's a really big challenge as well, not only for doing the research, but also understanding or trying to get a handle on how that technology is changing us, if at all, as people and as groups. And there's certainly some people out there who like to pitch fairly easy, or what sound like very easy answers, like Facebook makes people depressed, or Instagram harms teenage girls. And the reality is that no one's saying that online harms don't exist. Of course they do. Misinformation's a big problem. People being online bullied online is a problem. But the kind of more complex impacts in terms of people's mental health are really difficult problems, are really challenging questions in their own right, and the answer is not going to be straightforward. I think it's an interesting area to work in because it is constantly evolving, and I think for academics that is kind of reflective of a lot of areas, in that we're publishing a lot more stuff. There's more papers now coming out than there ever was before, and it's actually technology that partly enables that. But it does make it quite hard then to keep grounded on what's going on. By the same token, if you're working with new technology, all it takes is for another new technology to come along and you are like, all right, now I've got to get to grips with this. We do a lot of work as well in things like what I would term like genuine online harms. So, you're trying to, so postdocs at the moment are trying to map out like what is online harm. And most of the kind of definitions from psychology are very, very general, in that, it's addictive, or it's just generally a problem. Whereas actually real online harm is about being exposed to misinformation, or not maybe being physically active enough, or having your data compromised. These are the areas that really are genuine problems, and in my view we should be investigating. That will then have a positive impact on people in society. I think just telling people, or telling parents, don't let your kids use Instagram, is not going to work.